I know from day one you were you saw this, your forecast that this is not going to do well. Are we better off like 2 years after that whole noise about Obamacare? Are patients getting better access, better care? Are they paying not as much as you thought? What's going on? In your New York Post, you were very clear. Obamacare stinks, and I guess you have a way to show your emotion.
Well, look, more people are covered with insurance than were covered before. But the problem is, overall, the system may not be getting you the access you're used to, and there's a watered-down effect. Let me start with the issue of narrow networks. Under the Obamacare policies, you go to the exchange and you get a narrow limitation of the number of doctors you can have. And I said in the New York Post that I had a patient with severe psoriasis who I was treating, and then the doctor that I was using wasn't taking it anymore, and I had to use a lesser treatment. And somebody wrote to the New York Post guy and editor who knew him and said, I don't believe that actually happens. So let me tell you a story. I was at a dinner the other night, and someone said to me, there are only 2 doctors in New York who can do prostatectomies properly, and one is Dr. David Samadi. And I said to him, I don't really believe there's a second one. And the point
Thank
is,
you. You're being very kind.
No, but I'm not. I'm really mean that. I mean, look, you have laparoscopic training, you have open training, you have 6,000 cases now. You do it in an hour and a half. People get out the same day. Well, if I was a patient with a prostate cancer, God forbid I ever have that, why would I go to anyone else? And here's the reason: narrow networks. Because I can't ask you to take every possible insurance under the sun that may pay you a very limited amount. That's the problem with Obamacare. One problem is the narrow networks. Doctors like you and doctors like me are not going to take every possible insurance.
So here's what's going on also. I mean, there's so much pressure on the hospitals nowadays. They're reducing the payments. They're also in April 2015, which is only like a couple of weeks from now. Medicare is coming in with some like rating system where you get like 5 stars. It's almost like these letters outside the restaurants. You have A, it's a good restaurant. B is a bad restaurant. C, if you go in, you're going to get stomach pain and you're going to die. So based on what's going on over here, they have the patient surveys that all goes into Medicare. Then they give you a rating to the hospital. And so these are the things that they look at: long emergency room wait time in general, care transition, cleanliness, pain management. So how do they judge these hospitals? If somebody wants to please the patient, they would give more morphine, they would give more Percocet to keep the patient happy, as opposed to the quality of care. Maybe the doctor is really a good doctor, but he doesn't think he should be on Percocet or on all this stuff. Are the doctors and hospitals being judged by all these guidelines and all these like pressure that's coming down from Obama?
That's a really great point, because the real way to take care of a patient, and you and I have talked about this on Fox News a lot, it's about the art of medicine. You know the science, and then when you apply it on a patient-by-patient basis, you tell the truth. And you may say to the patient, I don't want to give you that pain med. You know what? He's going to write in a survey that you're a terrible doctor because you won't give him what he asked for. And that's going to put us in a very, very compromised position. I think there's way too much evaluation going on. Let's recognize that quality of care is hard to put a number on. I mean, it's like the PSA. You were talking about the PSA before, David. I always say the PSA is as good as the doctor evaluating it. It's not a number. It's what you do with the number.
Well, there's an art to it, and I think like you really need to be in it and be the expert. Just like I would never like really try to diagnose pneumonia, which is all your field. So I think the value of experts is absolutely important. I want to take a quick break, and I want to come back with more questions about this whole Obamacare and what we're going to be talking on Fox News today. I know childhood obesity and diabetes is very close to you. You have had a lot of initiatives, interviews from McDonald's to delis, and now today you have something going on with the cafeteria in school system and how private sector can help with this. So when we come back, we'll have Dr. Siegel talking to us.